Dallas is a city that pulsates, a place where the action never stops. From the fury of a bucking bronco to the velocity of a bullet.
Next thing I know, there's just two masked men and a guy has a gun in my face.
It's a place where strains of the Wild West
Be careful, Gina.
still surface in suburban backyards.
Texas itself has a severe rabies outbreak right now.
Oh, dang.
With so much at stake, doctors are always on call because Dallas is a city where actions speak. Dallas, Texas, arguably the most famous city in the state, that leads the nation in nuclear power, ranching, and oil production. But it is also the gun violence capital of America, where every day bullets shatter lives.
One went in and apparently shattered all this bone and then exited my head. The second bullet went in and went back farther and is still lodged. I still have a bullet in my head right here.
On November 16, 2000, Jane London was shot twice in the face at point-blank range during an armed robbery attempt.
The bullet itself took all the bone of this left front quadrant, and it goes across my entire forehead and all the way back, and I have no bone at all here.
The attack left Jane blind in her left eye and horribly disfigured. Today, she lives in constant fear.
I'm afraid somebody's going to come in and get me. This is more like terror. There's nothing to pinpoint. You just are, you're gripped. I'm gripped by it.
Okay, so how have you been since we saw you?
Okay, much better since last time I was here.
Each year, more than 4,000 people are injured or killed in Texas in gun-related violence.
How far can you open now? Is that farther than you could open?
Uh-huh, I couldn't open
Put
it.
your head back here just for a second.
At the International Craniofacial Institute at Medical City, Dallas,
Have you lost weight?
Maybe a little, but
Your
no.
face looks thinner.
Good. It was pretty swollen.
No, yeah, really, it really looks a lot thinner.
Jane is meeting with surgeons Kenneth Sawyer and David Jenikoff.
Incision there.
Incision goes all the way across.
She's got it all the way across, I think, someplace.
Yeah,
So I
it
remember.
goes ear to ear.
And then
There
there's
it
two
is.
little holes.
It's interior.
They are preparing for a radical surgery that is less than 24 hours away, an attempt to reconstruct Jane's badly damaged face.
But I would like to see some photographs.
There's one I won't show you. That's one. You can see my face well. It affects me to have it like it is. I teach after-school science to mostly first and second graders. Some of them go up to about fifth grade, but usually they're first and second graders. And I've had a situation where there was a little boy. He was just terrified of me.
What we're planning on doing tomorrow is rebuilding this area and also the orbit, so the roof of the orbit. And we most likely will use, the skull from over here like this.
And that area's been traumatized, so
Right.
I'm assuming my own bone's going to do better there.
Your own bone is going to do better here, yeah.
Right.
Okay.
Our biggest goal in surgery is to replace like with like. In other words, use her tissues to reconstruct her tissues. So we'll take bone from the back and side of her skull. We'll split it longitudinally, so there's an outer half and an inner half, and use that to reconstruct what's missing. With this operation, there is a risk of having seizures after the
I
operation.
fully understand the
There's
seizure
a
risk.
risk of another CSF leak, a fluid leak
I
that may have to
understand.
be dealt with. And there's risk of infection and possible bone loss.
We're going to start early in the morning. And we'll be there for till whatever it takes to be through.
Right.
We'll take good care of you.
Okay.
I believe that or I wouldn't be here.
All right. Okay.
All right.
It's nice to meet you.
Nice to meet you.
The Dallas-Fort Worth area is grappling with a near crisis.
Get it.
One that is threatening the lives of its residents.
Be careful, Gina. Who did the dog bite? How bad?
Just 2 punctures.
No stitches? Texas itself has a severe rabies outbreak right now. Why is it out?
Somebody left the gate open.
Well, I don't live here, so you got that responsibility, right?
Well, somebody came and opened the gate.
Yeah, but I didn't come and open the gate.
Well, I didn't either.
It's got rabies and city license?
Fort Worth Animal Control Supervisor Keen Menifee
Come on, sweetie. There we go.
spends most of his days picking up and impounding wildlife and stray dogs
There you go. Whoa. Careful.
that roam these rural neighborhoods, like the ones that attacked 8-year-old Dakota Mitchell.
And maybe, too, we can get Bubba to come out and play with you, and she'll keep the other dogs away. And he was dropping his bite to go play with his little friend, and the 2 dogs came at him then, and just started, you know, ripping at his clothes. He had on a new little jacket, and they tore holes in the back of that.
The yellow one was the one that bit me on the head. The second one was the one that got my ankle. And another dog got my hip and then my shoulder and this arm.
We got 8 staples in our head. He got some on this area here, and then some more back here in the back of his head. They cleaned his wounds on the back of his arm, on his shoulder, across his back. He had one coming down his hip, and again on his ankle, on the right leg.
Out in the field, animal control teams have their hands full.
We have 5 high-risk rabies carriers, and that's bats, raccoons, skunks, coyotes, and foxes.
He shouldn't go very long. I got him underneath that shoulder blade.
And in the state of Texas itself, we have 4 of the 5 rabies strands from those high-risk rabies carriers.
We had a skunk come back positive 2 streets over from your house for rabies. If you have a wild animal come onto your property, go ahead and stay away, keep an eye on it, and give us a call.
You ready, Joe? Our domestic animals is what bridges the gap between us and wildlife. When our animals are in the backyard and they're competing for food, for space, and so forth, that's when it becomes a concern as far as dealing with us contracting rabies through our domestic animals, because they came into contact with the wildlife in our area.
The dogs that bit Dakota are still at large, and they could be rabid.
Maybe we should call animal control when we get back to the house and make sure that they picked them up.
If animal control doesn't find both dogs,
Maybe they've got everyone but it.
Dakota will need a series of painful shots, or he will die.
If you start showing symptoms of it, unfortunately, it's 100% fatal at that point, and you're in trouble.
It's just because you got bit there once don't mean necessarily that you'll get bit there again.
Every year, the Dallas-Fort Worth area hosts more than 30 rodeos, making it the top rodeo center in the country. Today is the start of the Fort Worth Stock Show Rodeo, one of the top 10 annual events in the country. At stake is $375,000 in prize money. To win it, these cowboys are willing to risk everything.
I broke both ankles, dislocated both shoulders.
I've broken both of my ankles, ribs, pelvis, just about everything.
This is an extreme sport. In rodeo, it's not a matter of if, but when you're going to get injured.
Behind the scenes, the training room is at maximum capacity.
How long ago did you do this?
July, 4th of July.
Here, the trainers prep the cowboys for the competition under the supervision of the doctor.
Need more than that?
No,
or?
that'll work just fine.
So we'll put some little heat on it, and when you get through riding, you ought to come in and get an ice pack for it, too.
Yep, that'll be cool.
Okay.
The lead doctor at this event is Pat Evans. He's been repairing rodeo injuries for 30 years.
So we teach them, if they have a brace, how to put it on, how to tape it on properly, and then we teach them how to tape their knees, their ankles, their elbows.
And I'm just keeping this brace on there to keep me away from the knife as long as possible.
Who got the knife? We're ready.
I don't need that.
We're ready for it.
That's what you probably use on me too.
Well, they're not like a lot of other professional athletes. They don't get paid unless they compete and unless they win.
While Dr. Evans mans the medical station,
Busy, not too bad.
trainer Bill Ziegler is ringside, anticipating injuries.
Here we have 2 trainers out here in the arena at all times. We want to get to them as quickly and as safely as we can.
Lord, what a wild horse start.
You just have to stay ready. You never know what's going to happen.
Just fell off and landed on it. Oh my God.
You stuck your hand out?
Yeah, instead of breaking it, I could just feel the hole inside just twist.
Bend over. Okay. All right, straighten back up. That hurt. You have to know what the injury is. You don't have to know what the consequences of the injury could be.
Yeah, it's more kind of down on the side.
You do what you can to get them back as safely as you can.
When one of these athletes gets hurt,
Just take it easy, all right? Huh? Your neck all right?
we start at the very beginning, evaluating the injury, determining whether they need emergency care, whether they need care that can be taken care of in the training room.
Had an orthopedist x-ray your back and look at it. No. You need to get some real x-rays by an orthopedist.
It is estimated that more than 700 rodeo riders are hurt each year. The most troubling injuries are to the head, neck, and torso. Concussions, spinal injuries, and internal bleeding can be difficult to spot.
When you snapped your head back, okay? Got a couple small muscles in here, okay? That basically got stretched, strained, they're trying to tighten back down. Those muscles are pinching on that artery, okay? That's why your hands are going to sleep.
The injuries are piling up. And the most dangerous event is still to come. The bull riding competition, where oftentimes the 1,800-pound bull wins and the cowboy gets dumped in the dirt. In her 41 years, Lorna Turley has nearly died 6 times.
When we moved to Texas, I was on the treadmill when my heart stopped.
And she wants to know why. For almost 41 years, she's grappled with a medical mystery.
To begin with, I was a stillborn baby.
Throughout her life, Lorna has been constantly sick, plagued by everything from severe headaches and vomiting to kidney failure and frequent unpredictable fainting spells.
I had what they were TIAs, which are mild strokes. And the neurologist could not tell me why I had had the strokes. They kept saying, well, these are just really mild strokes. And that was pretty frustrating because I lost the ability to read. I couldn't speak clearly. And I said, well, excuse me, but this is not mild. You can call it mild all you want, but it's not mild if it impacts my life. So what can we do?
She said she would be nice and wait for me.
Doctor after doctor failed to diagnose Lorna's illness.
I had doctors that had me keep record of what day of the month it was, what day of the calendar year. You know, was I outside? Was I inside? What had I eaten? I kept track of everything that I ate, what kind of clothing did I wear, what kind of laundry soap was used when I laundered the clothes, everything. I felt like I really was dying. And I had tried to come to terms with the whole idea that, okay, this is it, and I'm not going to get better, and why drag my family through any more sadness or medical bills?
To make matters worse, Lorna's daughters, Chantel and Jessica began displaying the same mysterious symptoms.
It was during my high school years. I was passing out and turning blue on a regular basis, and at the time I was being treated for asthma. I was taking 21 asthma medications.
I've had episodes throughout my life. I had one major episode at school where I got really sick, and I just was really nauseated all of a sudden, and so I put my head down, and the next thing I knew, it had been about 30 minutes, and so I had passed out, and I had throw up all over me, and I was still throwing up. My mom looked for so long trying to find a cure. She kept going even though people told her that she was crazy.
So if you guys end up going there on a date, you'll probably not be staying long.
As it would turn out, Lorna wasn't crazy. She was about to discover the identity of her mysterious illness from a source that found the answer in outer space. On the streets of Dallas, Jane London and her sister Joy are retracing the steps of a nightmare. Jane has not seen this place since the night she was shot.
So where did this happen?
Up here, actually. You know, he called me and he had said that there was a special place that you had to park when you're a visitor.
On the night of the shooting, Jane was visiting her friend, Erin Powell.
You know, you just pull in a park. Yeah. Who thinks about it? So it was, I was just parked like right here. And then he lives. Want me to show you where he lives?
Yeah.
Jane parked her car and visited with Erin for about 2 hours.
So when we left, we just walked right out and walked down. And then that's where I went and got my Jeep was just like right in here. The Jeep was running. My door's open and Erin's kind of standing like almost on the outside of the door, you know?
Talking.
And next thing, I mean, it was just instantaneous. Next thing I know, there's just 2 masked men and guy has a gun in my face. He said, give us your money, give me your purse. Everything from that point happened so fast.
Jane's friend, Erin, was killed in the attack. Jane was left for dead.
It was just...
How do you feel right now?
I'm terrified. Absolutely terrified. I know. You know, it's not like I think somebody's gonna jump out and get me right now, but it's not like I still don't think that, you know, a little bit. Can't explain it. It's like paralyzing. Your brain's not thinking anything, it's just happening. What are you doing?
Jane's attackers have never been caught, but she hopes that after tomorrow's surgery, life will gradually return to normal.
You will. I'm not scared or anything. I mean, not of the operation. No. They can't give me my sight back, and they can't do anything about the nerve damage. I expect them to reconstruct the disfigurement that I have on my face and on my head. I don't know how much it will improve. Obviously, we're hoping it will. They'll know more when they open me up and get in there. Oh, yeah? You've never been the good one. I've never been the good one. But you've been the pretty one. Yeah, I was. And now you will be again.
Rodeo bull riding is one of the most demanding competitions in all of sports. Man versus an 1,800-pound beast in the ultimate test of strength and courage. During the 8 seconds a cowboy tries to stay on the bull, his body takes a brutal beating. But the real danger comes when he hits the dirt. Bull riders suffer more serious injuries than any other rodeo performer. The only thing standing between them and a ton of raging terror is the rodeo clown.
You know, basically they're fighting bulls, keeping them bulls off them guys.
Corey Wall is one of the 2 clowns working on foot. There's a 3rd clown working the barrel, Troy Lurwill.
My job in the barrel is basically an island of safety for the bull riders. If I see a nasty one there and I'm in my barrel, I'll try and get my barrel up there.
The barrel is reinforced and heavily padded.
If them guys know that I'm right there and can get that barrel between the bull and themselves, it a lot of times saves them from seeing these guys.
Each cowboy must complete 3 8-second rides to stay in the running for the prize money, with only a rope to hang on to. On his first ride, bull rider Chad Mayfield gets hurt.
Our bull stepped on the calf.
Just get on there. Push down with your foot. Good.
Todd Naughter took a look at him over there and made sure that there wasn't an obvious fracture. Then started checking to see how good a strength he had in the muscle that he got stepped on.
Okay, that hurts.
That hurts? Okay, pull it. You end up with a nice bruise.
He's going to be very sore in that area. Even though he did put ice on for about 20 minutes.
The injury isn't bad enough to sideline Chad.
Now you can't let this stiffen up on you tonight, okay? You gotta start moving your foot around, okay?
But before the night is over, one rider will suffer an injury so serious it will jeopardize his entire career.
Caught raccoon in a trap.
In the Dallas-Fort Worth area, raccoons are one of the top 5 carriers of the deadly rabies virus. And rabid raccoons can easily infect domestic animals, which in turn may infect their owners. Animal Control Supervisor Keen Menifee estimates that each year, more than 1,000 people in the area get bitten by wild or domestic animals.
God dang. Whenever people do get bit, there's that automatic concern of what happens now and what could happen to me type thing. There we go. And victims get real worried about the consequences and the risks of rabies, and they get real scared.
The onset of the clinical signs in humans involve agitation, irritability. It progresses into anxiety, almost then into a comatose, encephalitis state, comatose, and then death. So it's very progressive, it's very fast, over a 2 to 3 day period when it happens.
If an animal bites another human, that animal has to be placed in rabies quarantine for 10 days from the date of the bite. In those 10 days, they're observed at least twice a day. Any changes in behavior or health and that sort of thing is marked on their paperwork. If we come in the morning, we have a dog that's deceased overnight, we instantly have to send that animal off to Austin for testing because we don't know what it died of overnight. And we've got to be sure because we have a human victim whose life can be on the line in something like this.
We're doing some door-to-door in your neighborhood for a positive rabies case that came back.
Officers are going door to door, warning residents of a rabies outbreak that is causing a serious public health concern.
Brett, I see your dog there. If you can make sure that it's currently vaccinated.
Okay. Why don't you guys load them? We got 2 up the street here. Me and Gino will go take care of.
Meanwhile, the dogs that attacked Dakota Mitchell have been spotted but are still on the loose. Time is running out. They could attack again and put other lives at risk.
All right, I'm gonna pass him. It looks like we may have an alley.
Tell you what I'm gonna do. I'm gonna put a small one in your hand right now so we can get started and get you going. And I'll put if you want, I'll change it out once we're asleep, and I'll definitely put the other one in your arm also.
At 7 o'clock in the morning, Jane London is in the operating room at the International Craniofacial Institute at Medical City in Dallas.
Just a second. A little pinch in your hand first.
Yeah. I don't think anyone deserves to go on in life with a severe deformity like she has. We can't bring back the neurologic function that's gone, but we can give her certainly a better balance and harmony to her face and to her life.
Surgeons Kenneth Sawyer and David Jenikoff will be performing the complex procedure.
Stage number 1 is exposure of the entire field, exposure of the brain, the face, the head, the orbit, the eye, and freeing up all of the tissues where they're scarred down. And then stage number 2 is to determine the exact shape and size of the area that we're going to rebuild, that we're going to construct, and then create her new head and face.
The operation begins with the painstaking process of dismantling the bone in Jane's skull. Each step is first practiced on an acrylic model.
Take this, and then we'll take it back here, and you'll be able to see us splitting this, and then we'll put one piece back in, and then the other piece we'll use to put into the forehead, and we'll decide on the positioning, and then we'll also be changing the shape of this, because the shape isn't exactly the way we want it.
See, the bone has an inner side and an outer side and a soft side in between. And so what we're going to do is split it right down the soft side to use the outer side for reconstruction, and we'll put the inner side back. Can you squirt? You just tell me when. I'll just keep talking. This is bone dust. It has a lot of bone cells in it. We use that at the end of the case to fill in defects. So we're just saving all that bone dust.
Using Jane's own bone dust ensures that the rebuilt section of her skull will heal completely and be as strong as the original.
And here's a piece of bone we've cut, and we're just about ready to finish splitting it. So now we have the outer table and the inner table. This will go back on her skull, and this will be used to reconstruct her face. It'll be remodeled by the body and turned into bone. Good.
The cutting must be so precise, it takes a full 3 hours to complete.
What we've done is we've taken both bone flaps off. This is the center. Here's her defect over here. Can I see the bone now, please? So these were in here, like this. Okay, so those have come out. On the back table, we split them. We're going to use these pieces for the reconstruction, and we're just about to put these back together with plates and screws. We'll need some gel foam with a little bit of betadine. So when you put it back together, we're going to attach it to one side, so you have bone-to-bone contact on one side, and we'll fill the rest of it in with bone paste. And we use plates and screws to hold it up so she doesn't have a dent. The neurosurgeon's finished. The bone flaps are elevated. The brain has been dissected from its position and moved out of the way so we can then reconstruct everything the way we want it. So I'd have to say everything's going fine.
4 hours into surgery, doctors are now ready to perform the delicate task of using the pieces of Jane's skull to rebuild the front of her face.
Normal breath out, deep breath in, and then you're going to breathe in and out of that bag.
Desperate to find a diagnosis for the mysterious illness that has plagued her for 4 decades.
Oh, tilt, let me. Okay.
You haven't done a tilt before.
Not here.
Lorna Turley has turned to the Institute for Exercise and Environmental Medicine in Dallas.
You might, see some stars. Try to hold it steady.
How's that? Is that a little better?
Patients who come here often endure extreme tests.
Feel good, a little lightheaded, not bad. A little tingling in my arms.
The doctors and scientists at the Institute are experts on gravity. From the zero gravity of outer space to the effects of Earth's gravity on the human body.
What this equipment allows us to do is to measure the maximal gravitational stress that the cardiovascular system can handle.
The test Lorna is about to undergo is frequently used by NASA. Her unusual symptoms are virtually identical to those exhibited by astronauts after being in the zero gravity of outer space.
Okay, we'll begin a baseline in 3, 2, 1, begin.
The purpose of this test is to evaluate her cardiovascular response to the upright posture. We measure her heart rate and her blood pressure and her cardiac output, how much blood her heart is pumping, her stroke volume, how much blood it pumps with each heartbeat, and the reflex response to standing upright as the blood pools down in the lower extremities.
Keep it up. Keep it up.
The test enables Dr. Ben Levine, director of the clinic, to confirm what he believes is causing Lorna's extreme symptoms, a disorder known as POTS.
What it is an intolerance to gravity. We have these pressure sensors at the base of your neck and in the arch of your aorta, which sense the pressure in the body and the circulation at all times and send signals back to the brain. And to keep that pressure constant when you're lying down to when you're standing up. And what happens is sometimes the body fails to respond to gravity well, or in the case of an astronaut, they may, if they've been exposed to the absence of gravity, to zero gravity, they may lose that rapid ability to react to gravity very quickly. And so I think that it is a disorder that exists because we're here on Earth. I mean, Lorna's just fine while she's lying down, and most of these patients are. The problem is when they stand up.
We'll start in 15 seconds.
According to Dr. Levine, Lorna's symptoms, as well as those of her daughters, are typical of people who are hypersensitive to gravity.
This is the heart rate. The heart rate rises dramatically. This is up to 160 beats a minute. Because of her exuberant reflexes, the blood vessels have squeezed down really tightly, and the pulse has accelerated very rapidly. It's sort of like if you put your finger over the edge of a garden hose to raise the pressure, to squirt it a little farther. That's what her blood vessels are doing by releasing adrenaline and noradrenaline. So her blood pressure transiently goes through the roof.
Blood pressure's doing great.
Lorna is one of an estimated 500,000 Americans who are essentially allergic to gravity. But treatment for these patients is surprisingly simple, much of it centered on simple changes in diet, exercise, and lifestyle.
A little hot. We tell our patients, use a salt shaker, pour a lot of salt on your food, drink lots of water, and start an exercise program. We raise the head of the bed up on blocks at night. That lets gravity be working all the time, and the body doesn't lose the ability to adapt to gravity very well.
If exercise and diet can bring Lorna's symptoms under control, it will seem like a miracle after 4 decades of intense suffering.
I'm just going to watch you recover for about 2 or 3 minutes.
Being thrown off the back of a bucking bronco is like being hurled from a speeding car.
Sometimes the worst looking wrecks aren't bad at all, and the simple ones, that's where somebody really gets hurt.
But as dangerous as it is to be tossed in the ring, it's not the most dangerous place to be.
This is the chutes. This is where all the rides start, and this is actually the most dangerous part of the whole deal. When you're in the chute on a horse or on a bull, there's a lot can happen in there. So we will stay as close to the chutes as we can.
Before even getting out of the chute, bareback rider Mike Whitesell from Louisiana breaks his arm.
They just rammed up against the side of the bucking chute. Broke my arm on the gate. It's gonna slow me down for a while now.
Broke this bone right here called the radius. So when we brought him in here, tried to keep him stabilized and put ice on it. Then we anesthetized this with some local anesthesia. Then we washed the fracture area with a mixture of the local anesthesia, got out some of the blood, and put the local anesthesia back in.
Put the ice on it to kind of numb the pain, and fixing to take care of the rest.
With my experience, it's going to require surgery to stabilize the fracture with plate and screws. We're going to fix a little sling on him that he can hook it up in the air on his truck because he got to drive back to Louisiana, which is about an 8-hour drive.
You got something like the top to what? Truck?
Yeah.
8 hours of wondering if this time it's a career-ending injury. Jane London is undergoing facial reconstruction surgery at the International Craniofacial Institute at Medical City, Dallas.
Can we see some demineralized bone?
She has been on the operating table for more than 4 hours.
Looking at her pictures before, and she really had an eye that's down farther on the left than the right before her injury.
Surgeons are preparing to use the bone harvested from Jane's skull to rebuild the left side of her face. To accomplish this, they must give Jane a new forehead and orbit.
The orbit is where the eyeball sits. Each eyeball sits in its own ice cream cone, so to speak, and that's the orbit, okay? And it has bones top, side, bottom, and middle, and so she's missing the top and the lateral side, and so we're reconstructing that with the bone grafts.
Like a complex jigsaw puzzle, the pieces of Jane's skull are carefully put together with surgical screws and plates, hinting at what will be the shape of her new face.
We fixated and secured the bone grafts to the forehead and to the orbital root, and now we're shaping that bone that we fixed and trying to contour it and make it smooth. Because overall, the general contour of the left side was more difficult to match to the right side using the bone that she has. It's very brittle. You know, older people's bone doesn't bend like young kids, and so we've had to shape that bone, and now we're going to shape it some more.
The surgery is now in its 6th hour. The bone grafts are all in place.
We'll take bone dust to fill gaps in the bone with that, and that will help promote bone growth in those areas.
It's going to be hard like the rest of a skull.
That's just a dissolvable sheet of what's called methyl cellulose, and that'll just help hold the bone dust in position. It'll dissolve.
After 7 hours, the surgery is complete.
So we're real pleased, and she should do well. Everything looks good at this time, and we anticipate a good result. It's a joy and a pleasure to be able to reconstruct a face and create a new life.
Everything went real well. All right. The head looks good. You fixed your eye. You'll be real happy, okay? Very good.
We've got 2 of these salt shakers, and we go through 2 full containers every week, just from salting our food.
For Lorna Turley, salt has become a lifeline.
Like if we're sitting in a meeting and we're starting to get nauseated, we just eat a little salt packet and take a little swish of water.
Ever since being diagnosed with a disorder that makes her intolerant to gravity, she never goes anywhere without it. Lorna and her daughters now drink at least 2 gallons of water a day each and eat lots of salt.
The theory behind me eating as much salt as I can handle is just basically to help my body hold on to the fluid that I do drink in the day.
She has a test and then she'll be through, like she said, by 3:50.
Lorna and her daughters are also taking a prescription steroid that helps their bodies retain fluid. Retaining water enables them to better withstand gravity and makes them less susceptible to serious side effects of the disorder, such as heart problems and fainting spells.
Of all 3 of us, I can be standing longer than them, and they'll faint before me now.
Regular exercise is also now a mandatory part of their new daily routine, one that seems to be working.
His program has really changed my life. It's changed the lives of our family. We're able to have quite a great deal of normalcy back in our lives.
I've just been able to improve my quality of life back to what I was when I was in my 20s. It's given me back a quality of life that I not only didn't have, but I felt I was losing more each day.
Eight-year-old Dakota Mitchell is undergoing a painful, life-saving procedure after being attacked by 2 stray dogs.
He got a bite to his right shoulder, a bite to his right ankle,
a bite to his back, and a bite to the underside of the left upper arm, over the triceps muscle. In addition, he got 2 bites on the back of his head that required stitches. Hey, Dakota, how are you doing?
The dogs are still on the loose, so there is no way of knowing if they were rabid. Dr. Hayes is taking no chances.
We looked at it as 2 options. Either the dogs don't have rabies and Dakota's getting the vaccines, but he doesn't need it. Can I see your leg where you got bitten? How's that doing? In which case, he's gone through rather expensive treatment that's rather painful. Yeah, that's not too bad. Or we don't treat him for rabies, and he does have rabies, and he dies. We don't really have a whole lot of choice.
Goat, fox. This would probably be a bat. Nope, raccoon.
Bonnie Mays coordinates the rabies lab at the Texas Department of Health in Austin.
The rise in animal rabies in Texas poses a potential danger to Texans because an increase in rabies in wildlife is going to result in an increase in rabies cases in domestic animals and livestock, which of course are in close contact with humans, which puts humans at a greater risk. For this test, you need a fluorescent microscope. If you have rabies antigen present in the brain tissue, then you will see a bright green, kind of apple green fluorescence. And in most cases, especially with wild animals that have rabies, you will see green everywhere. However, if it's a weaker infection, you may only see a few patches of green dots here and there. Good for us, in most cases, it's real obvious.
So which shoulder do you want the shot in?
But like Dakota, bite victims must be promptly treated for rabies anytime the animal is still at large.
That's too bad. How did it feel after you got those shots when you first came in here? Did it hurt?
Yes.
I'm sorry. But what we had to do initially was we had to inject immunoglobulin, which is antibody to rabies, into each of the bites. And he had a big long bite up here, so we did a couple of injections into it. Then he had the bite on the back of the arm, and we did 1 or 2 injections into it. And then we had the bite on his leg, and we did 2 injections into it. And after that, we were out of vaccine after we injected here. Oh, is that right?
Dakota is in phase 3 of a 5-phase program of 1 shot per week.
Okay, you ready? 1, 2, 3.
If he misses a shot and the dog is rabid, he could develop rabies.
Get that Band-Aid on.
This is the 7-day shot, so the next one's at 14 days, and the next one after that is at 18 days.
Okay, we need to come back February 26th.
Dakota is safe, but the 2 strays are still on the loose. If they attack again, the outcome could be fatal.
He's friendly, he's just goofy.
It's been 10 days since bareback rider Mike Weitzel broke the radius bone in his right arm in a rodeo accident.
It's like the old saying, if you have a motorcycle and you know how to ride it, you need to quit. Because if there's not a fear there, you don't have respect for it.
It's a 5-point rowel.
Basically, they need to be blunt.
Mike's shattered bone is now held in place by a metal plate and screws. He's about to find out if the injury means the end to his career.
If the doctor recommends against riding, I really can't tell you what I'm gonna do. I guess that's a bridge I'm gonna have to cross when I come to it. I really enjoy it, and I don't know. I just gonna have to figure that out if it comes down to it.
Hey, Michael. How's it going?
Pretty good.
This is the first time Mike's arm will be examined since the surgery. Dr. David Pope of the Bone and Joint Clinic of Baton Rouge, Louisiana, is Mike's orthopedic surgeon.
His fracture was at about this level here, and the plate spans the fracture and holds everything in alignment until the bone is able to heal at about 10 to 12 weeks. And this is the side view of the same area. The metal plate and screws are holding that straight in alignment. He's made it over the first hurdle of the healing phase without any complications. He will start in some physical therapy with a hand or hand therapist to work on strength and motion of his forearm and his hand so that he can maintain and build his muscle strength. And then I'll plan to see you back here in about 3 weeks.
Okay.
All right? Good deal.
Thank you.
You bet.
Out of 30 injuries treated in just 2 days at the stock show Rodeo, Mike's was one of the most serious. Fewer than 100 such injuries occur each year. Fortunately, it was not so serious that it left him permanently on the sidelines.
So what do we want to do? Okay. Right citations too. I get sick and tired of dealing with these people. You know, they let their dogs run loose and that's okay, and then they got a daycare center right next door to them. It's ridiculous.
Keen Menifee and his animal control officers sometimes feel as if they are fighting a losing battle. The citizens of Tarrant County are not helping.
Okay, there's 2 on chains, but there's 3 that's not. Those 2, get them on a chain for us, okay? They got to be restrained, okay? As far as I'm concerned, the battle is me against the owners.
And the gates are wide open, and this dog's running around the front yard unrestrained. What's going on with the dog? Why is he unrestrained?
And that takes something a little bit more forceful. I'm willing to do that.
You've got 2 options, okay? One, you can just release her to us. At that point, she becomes the property of Fort Worth, and it's up to us what happens to her. I don't know how long we're going to be doing door-to-door.
The animals, they're not the ones that we're at war with. They actually become the prisoners of this war. And unfortunately, the only individual that ends up suffering in the end is the animal, because they pay with their life.
Dakota Mitchell's childhood has been dramatically affected by this month's events.
Now we play in the yard. You know, they're to stay behind the gate, period. And, you know, if they want to play with an animal or whatever, they play strictly with their dog. Otherwise, they play in the yard unless I supervise them going elsewhere.
Six weeks ago, Jane London underwent surgery to reconstruct the left side of her face.
I'm definitely wearing it back to where, at least similar to where I used to wear it before I got shot.
Before the surgery, Jane did everything she could to hide her deformity.
It was like it wasn't me. I wore hats. I finally got enough hair to grow bangs. I wanted to cover it up. It was embarrassing. It was embarrassing. I felt like I had half a head, and I looked like I had half a head.
It will be many months before the swelling in Jane's face will completely heal from the surgery.
Nothing feels natural anymore. Everything feels like I'm doing it to somebody else. It's like it's somebody else's face, it's somebody else's head.
But her surgically repaired face is giving her the strength to step back out into the world.
I don't think you ever get your life back. I don't think that's possible after something as traumatic as being shot twice in the head. It's kind of sort of what I want, but not that pink. I mean, I want like more muted, like it affects who you are, how you feel, what you look like every day of your life for the rest of your life. I have a hangnail on that one, so you have to be careful.
Dallas is a city built on the promise of big dreams. But dreams can shatter. Sometimes the miracle of medicine helps put them back together, one fragile piece at a time.